Hey guys, welcome and welcome back to my channel. I hope you all are doing good and have watched my previous videos. This is Dr. Prasanjit Das and you are watching Prasu'S Medledge series. So guys, today I'm going to do an active recall session for the topic lung abscess. So if you haven't read this topic before, you can check out one of my previous video on lung abscess. I will be providing the link to it, so you can just directly click on the I button and watch that video first. And if you have already read this topic from some other source, be it a textbook or my videos, then you can directly dive into this session. So firstly, I will read out the questions. So first question is, what is a lung abscess? So basically define lung abscess. Then what is the most common cause of lung abscess? Then name some pre-existing sources of infection for aspiration, because the aspiration is one of the causes for lung abscess. Next is name the dominant organisms present in aspiration abscess. Why are aspiration abscesses more common in right lung? What are the causes for hematogenous spread of organisms to the lung leading to multiple lung abscesses? Next is enumerate the causes for lung abscess. So basically the etiology of lung abscess. What are the two modes of presentation of lung abscess based on duration of symptoms? Then we have describe the characteristics of acute presentation of lung abscess and describe the characteristics of chronic presentation of lung abscess. What are the general examination findings seen in lung abscess? What are the respiratory system examination findings seen in lung abscess? What are the CBC findings seen in lung abscess? What are the chest X-ray findings seen in lung abscess? Next is enumerate the investigative modalities which can be used in lung abscess evaluation and diagnosis. What are the complications of lung abscess? What is the management of lung abscess? Then name the antibiotics with their appropriate dosage which can be used for the management of lung abscess. And finally, what are the indications to perform resectional surgery in a patient with lung abscess? Now let's try to answer these questions one by one. So first question is, what is a lung abscess? So lung abscess is basically a necrotic area of the lung parenchyma which contains purulent material. So basically in the lung we will have area which contains purulent material, and it is a well circumscribed area. So this is what is called as lung abscess. Next question is, what is the most common cause of lung abscess? So the most common cause of lung abscess is basically aspiration. So aspiration, that is aspiration of the nasopharyngeal and oropharyngeal contents. Next question is some pre-existing sources of infection for aspiration. So basically we said that the aspiration occurs from the oropharynx and the nasopharynx. So there should be some focus of infection in that area. So it includes sinusitis, then we have dental caries, then sometimes gingivitis also. So these are the foci of infection which can be present in nasopharynx and oropharynx. Now next question is, name the dominant organisms present in aspiration abscess. So basically in this we will have two organisms, that is Haemophilus influenza, and the other one which is very common is streptococci. Next is, why are aspiration abscess more common in right lung? So the answer for this is the right main bronchus is actually having a relatively vertical course compared to the left main bronchus. So this facilitates the drainage of the aspirated contents into the right lung easily compared to that of the left lung. So that's why aspiration abscesses are more common in right lung. Next is, what are the causes for hematogenous spread of organisms to lung leading to multiple lung abscess? So the causes for hematogenous spread includes bacteremia, then we have septic thrombophlebitis, and we also have endocarditis. So these are the three main sources from where the hematogenous spread of organisms occur, leading to multiple lung abscess. Now coming to the causes of lung abscess, so few causes which we have already discussed includes aspiration of the nasopharyngeal and oropharyngeal contents. Then we have hematogenous spread of infection. Then we also have depression of the cuff reflex. Then apart from that, we also have pulmonary TB, which is a very important cause of lung abscess, especially in India, because in India TB is very common. Apart from this, we also have some conditions which leads to aspiration of the content. So basically we have gastroesophageal reflux disease, then we have achalasia cardia. So these all conditions lead to lung abscess. Coming to the next question, that is two modes of presentation of lung abscess based on duration of symptoms. So it includes acute and chronic. So acute means basically the symptoms persist for less than 1 month, whereas chronic means symptoms persist for more than 1 month. So they will have different features. In acute presentation, the patient will have high grade fever, then along with that there will be chills and rigor. Then initially the patient will be coughing and that will be dry cough. Later on, when the abscess ruptures into a patent bronchus, the patient will start producing wet cough. So there will be wet cough and it will be highly purulent. So this is the course which is seen in case of acute presentation of lung abscess. Now coming to the chronic presentation. So chronic presentation is basically having an insidious onset, and here the patient will have fever but it is not that high grade. Along with that we have other features like anorexia, that is loss of appetite, then we have loss of weight, then we also have putrid smelling sputum. Now coming to the general examination findings which are seen in lung abscess. So it basically includes clubbing, then we have foul smelling breath, that is halitosis. Then as I have already mentioned, that is fever is there, can be high grade or low grade. Then we also have anemia, that is in the form of pallor. So we can also have pallor as a finding. Now, what are the respiratory system examination findings seen in lung abscess? So initially, there won't be much findings in the respiratory system examination, but later on, we can get the following findings. That is, because of the presence of the lung abscess, there can be increased vocal resonance, then increased vocal fremitus. Then, because the lung parenchyma is affected, so we can also get bronchial breathing. Then we will also get area of dullness on percussion over the area of lung abscess. So these are the respiratory system findings which we get later on in lung abscess. Initially we won't get much findings in respiratory system examination in case of lung abscess. Next is the CBC findings which we see in lung abscess. So first I have already mentioned, since in general examination we see pallor, so one finding which we will get in CBC is anemia. Then lung abscess is basically occurring due to infection, so we can also get leukocytosis, that is increase in WBC count, and since it is an infective condition, so we will also get raised ESR. So these are the findings which we see in CBC in case of lung abscess. Coming to the chest X-ray findings seen in lung abscess, so in this we will see an area of radiolucency. Okay, so this radiolucency is signifying lung abscess within an area of consolidation, which will be opaque, that is basically white in color. Now coming to the next question, that is investigative modalities which can be used in case of lung abscess evaluation and diagnosis. First is CBC, as I have already mentioned. Then we have chest X-ray. Then we can do sputum studies. Sputum studies include gram staining, then Zeal-Nielsen staining, and then we can also do the culture and sensitivity so as to decide the antibiotics which has to be given to this patient. Then apart from this, we can also do bronchoscopy, and finally we can also do CT scan of the thorax. Now coming to the complications of lung abscess. So complication of lung abscess include basically empyema, then we have pleural effusion, then pyoneumothorax, then pneumothorax, and when the lung abscess heals, it can also lead to residual fibrosis, and along with that, we also have hemoptysis as a complication too. Now coming to the management of lung abscess. So management of lung abscess basically includes postural drainage and physiotherapy. Then we can also give antibiotics. Then in case of large abscess, we do the percutaneous aspiration of the abscess, and we do the placement of pigtail catheters. So the antibiotics which we use here includes amoxicillin clavulanic acid, that is 625 milligram, which is given 3 times daily. And if the infection is due to some anaerobic organisms, then we can also add metronidazole 400 milligram. Next is, what are the indications to perform recessional surgery in a patient with lung abscess? So recession surgery is basically removing a part of the lung which is diseased. So this is done in case of lung abscess when there is massive hemoptysis, and if there is a persistent lung abscess cavity, and in case of a localized malignancy. So guys, this was about the active recall session for lung abscess. So I was able to form a total of 19 questions, but this doesn't end the topic. You can always add some more questions if you find it out while reading some books, and definitely add those questions in the comment section along with the answer for that, so that other people can also get to know the other questions which can be formed out of this topic. So I hope you liked the active recall session. If you like my content, please do like, share, subscribe, comment, and also press the bell icon to get notified whenever I post a new video. So thank you guys.